A public service announcement. Admission to an acute crisis psychiatric unit. This message is brought to you as a public service of In His Holy Name Ministry and the Independent Catholic Podcast. Look us up on the web at His Holy Name, one word, dot. Yolasite, oneword.com.
An acute psychiatric hospital unit, sometimes called a psychiatric crisis unit, is a locked unit within a hospital that provides short-term care for individuals with mental health issues. It is specifically designed to provide intensive treatment and support for those in crisis. The length of stay in an acute psychiatric unit typically ranges from a few days up to 2 weeks, depending on the individual's needs and progress. During this time, individuals receive round-the-clock supervision. Being on an acute crisis psychiatric unit can be a stressful experience. It is important to understand the general rules of the unit so that you can make sure that your stay is as comfortable and safe as possible. The rules for each unit have been designed for patient, visitor, and staff safety. These rules are intended for all patients across the board with no individual exception. For instance, one patient may be safe with a wire coil notebook, but another patient may not be and in turn could take the object and use that wire to hurt himself or others. So in turn the rules must be the same across the board for the entire milieu. The general rules on an acute crisis psychiatric unit include appropriate conduct and behavior, participation in group activities, and seeing providers when requested. These rules are designed to ensure that all patients receive the best care possible and remain safe while in the hospital. Additionally, these rules help to create a supportive environment for everyone in the unit, which can be beneficial for those who are struggling with mental health issues. They are enforced without exceptions. In a psychiatric unit, there are certain rules and regulations that must be followed in order to ensure the safety and well-being of all patients. These rules often include no cell phones or recording devices, appropriate clothing, no clothes with strings or revealing clothes, or clothing with inappropriate art or logos, limited visiting hours, and no sharp objects such as wires, clippers, scissors, etc. All of these rules are designed to protect the privacy and safety of all patients in the unit. By following these rules, psychiatric units can ensure that everyone is safe and secure during their stay. As a patient, if you have any questions regarding to the rules and what may or may not be allowed on the unit, a family member or your emergency room nurse can call the unit the patient is being referred to before leaving the emergency room and ask questions. It is also advisable for friends and family to call ahead about visiting hours and what can and cannot be brought in for the patient. Activities in a crisis unit are limited to groups. One-to-one therapy is unlikely to happen. The groups are intended to educate about medications, coping skills, and disease management for the short admission duration. Therapy is done in outpatient and is for the long haul. Group attendance is greatly encouraged on crisis units. Visiting a patient in an acute psychiatric unit can be a difficult experience, especially for children under 18. With the safety of the child being of utmost importance, it is important to consider all aspects before allowing a child to visit such a facility. It is also important to consider the potential trauma that could be caused by exposing them to inappropriate patient behavior and other risks such as any violence from other patients that could occur with such visits. Therefore, it is essential for parents and guardians to weigh the pros and cons before deciding whether or not their child should visit patients in an acute psychiatric unit. Many who are unfamiliar with patient rights and psychiatric behavior often believe the staff can stop phone calls or inappropriate language and/or behavior. Staff are actually very limited in what they can do and in truth are often unable to control the inappropriate behavior of some of their patients. This can include making abusive or frequent outgoing phone calls, using foul language, and engaging in other disruptive activities. If you are receiving abusive or unwanted contact from an inpatient, there are 2 effective measures that are recommended. Notify the nursing staff, though they are limited in what they can do. Alerting them may help. And then notify the police and proceed with the appropriate legal actions. Mental illness is not an excuse for bad or illegal behaviors. When calling the hospital about a patient, it is important to remember that all information shared must be in compliance with HIPAA and other regulations. Nurses must be sure to follow all laws and regulations when it comes to releasing information. They should never share any patient information without the written consent of the patient or their legal guardian. This includes acknowledging if a patient has been admitted. The patient or legal guardian, if applicable, must sign and fill out a legal form called a release of information before hospital staff can even acknowledge if a patient has been admitted. Please don't get angry at the staff if they answer you with something like, "Due to federal confidentiality regulations, I can neither confirm or deny we have a patient by that name." All the pleading, threatening, and name-calling will not change the staff response and will only alienate you and upset them. Remember, the staff is only following the law, and that means even admitting if the patient is there. If you call and there is no release, and you get the standard line, "I can neither confirm or deny we have a patient by that name," and you are pretty sure the patient has been admitted, and you feel you have important information that may affect that patient's care, there is something you actually can do. You can tell the staff that if such a patient has been admitted, you would like to share some information. Be sure to identify yourself. Staff can listen and not comment or respond without a release of information. Again, they can listen. What they can't do is speak about the patient and provide any information. What you have to say may be very important, you will be heard. Just don't expect a response admitting that the patient is there. Being admitted to a psychiatric crisis unit is stressful for all involved. Inpatient treatment will not resolve the mental illness. Its purpose is to address the crisis. The patient will need to follow up with outpatient treatment to include therapy, medication management, and possibly attending support groups. Inpatient treatment at this level is only to get the individual out of crisis. All involved have a long road ahead.